This week on the Wheelhouse, the future of Medicaid in Connecticut and across the country. For Connecticut Public, I'm Frankie Graziano. This is the Wheelhouse, the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond, right here. Elon Musk and the Department of Government Efficiency want to cut nearly $1 trillion in federal spending by this September. So far, DOGE has canceled contracts, laid off thousands of federal workers, ended leases, and more. Those account for a small slice of the spending pie. The federal government spends the most money on things like veterans benefits and services, Social Security, Medicare, and Medicaid. Many people in Connecticut and across the country rely on Medicare and Medicaid for health insurance. So how could federal funding cuts impact their access to medical care? To help me break this down, I'm joined by Connecticut State Comptroller Sean Scanlon. Comptroller, thank you so much for joining me.
Good morning, Frankie.
Good to see you on the Wheelhouse this morning. We also spoke ahead of this hour with State Representative Vincent Candelora, the House Republican leader. Representative Candelora couldn't join us live due to a scheduling conflict, but you'll hear some of his thoughts on the future of Medicaid this hour, too. Let us know if you got questions for State Comptroller Sean Scanlon. Join the conversation, 888-720-9677, 888-720-9677. Comptroller, residents in Connecticut rely on both Medicare and Medicaid. Before we dig into the latest, I want you to remind us of where they overlap and where they might not, how they're different.
Well, the most simplest explanation, Frankie, is that Medicare is health insurance for people over the age of 65, and Medicaid is health insurance for small children, people with disabilities, seniors in nursing homes. It's 1 million people total who are on Medicaid right now in the state.
Who are the residents that rely on Medicaid?
It's your friends, it's your neighbors, it's your loved ones, it's the children of our state, it's people with disabilities, it's people who are in nursing homes, seniors who go to nursing homes, use Medicaid, not Medicare for that. It's low-income people. At its most basic level, it's the most vulnerable people of our state, and about a third of our state in some way is benefiting from Medicaid. And it's 1 million people that are in every single community in our state.
Are there concerns about both Medicare and Medicaid at this moment, or would one of those bear the brunt of the cuts?
Well, as the chief financial officer and fiscal watchdog of the state, I'm worried about everything. But I think the most pressing thing right now is Medicaid, because Congress has passed a Budget Reconciliation Act that has instructed the committee that is in charge of Medicaid and Medicare to find $880 billion of cuts over the next 10 years. And the nonpartisan Congressional Budget Office said that if they cut every single thing in their committee's jurisdiction, Frankie, besides Medicaid and Medicare, they still need to come up with $600 billion of cuts. So I think, and the state thinks, that we are on course to see them try to cut Medicaid. We are doing our best to prepare for that and model out different assumptions of that. But I have to tell you that everywhere I go, whether it's conversations with hospital leaders, whether it's conversations in the grocery store, people are freaked out about this, and they should be, because this is a lifeline program for many, many, many people in our state.
When it comes to potential cuts to Medicaid, tell us more about the impact that it would have on Connecticut's residents.
Well, like I said, this committee has not released the details of how they're going to do it, but it's a math equation, and I'm the math guy. So I can tell you that there's no way for them to get to the cuts that they need. By the way, they're doing this to fund an extension of the president's tax cut for the wealthiest in our state and the wealthiest in our country. And they're doing that almost certainly by cutting healthcare for the most vulnerable population of Connecticut. So the governor and the commissioner of the agency that oversees Medicaid have been doing a bit of modeling. Our office has been involved in that. But no matter what they decide to do, any cut, I want to be very clear, will have devastating consequences for the people in the state. And sometimes as we discuss this and we talk about, we get $6 billion of federal aid for Medicaid, there's $880 billion of cuts, and there's a million people, we sort of get lost in the clouds of numbers. This is about your child who may be on Medicaid. This is about your disabled sibling who is receiving health care because of Medicaid. It's about your grandma or your grandpa in a nursing home. Everybody in the state's life will be touched in some way by this. It's not abstract, it's real.
This is both a federal and state program. What responsibility does, and I think you just kind of nailed it right there at the end, what responsibility does Connecticut generally owe to this program to make it both a state and federal venture?
So how Medicaid works is that the state puts forward some money and the federal government matches that. And they do most cases beyond matching it. So for example, it's a $3.3 billion program in our state, but we get $6 billion in the last fiscal year from the feds for this. So altogether, over $9 billion is spent on this. Is one of the biggest things that we do as a state. But we are heavily reliant on that federal share to come in, as is every other state in the country. And so we have some flexibility of how we can design our program here and who we cover and who we don't. But all of us rely on that, what's called federal share of Medicaid. And any cut to that federal share will result in us cutting benefits here in the state. Because while we have turned around our fiscal house and we have a very healthy rainy day fund of $4 billion, we just simply can't compensate for all the federal money that we would lose both for Medicaid and for every other program that we're seeing cut almost on a daily basis here in the state of Connecticut because of what's happening under President Trump and Elon Musk.
In your 2025 Comptroller's Healthcare Cabinet Report, you said that increasing reimbursement rates for Medicaid and Medicare a top priority. Why is this issue so pressing?
Well, look, it's somewhat of a dual world that we're living here, right? Where we came into this year of 2025 as a state trying to raise the Medicaid rates, which is something that we have tried to do in the state for a long time. We are underfunding, in my mind, a lot of the Medicaid rate providers that are helping the people that are on Medicaid. And when you don't properly fund them and when you don't raise their reimbursement rates, less and less doctors see Medicaid patients, and that is very bad for the people who are trying to get seen by a doctor, obviously. So we came into this year, both the governor, myself, my cabinet, the legislature, all wanting to increase the Medicaid rates, and we still do. But it'll be almost impossible for us to raise the rates when we're talking about just trying to hang on if we see less federal money. So in all this uncertainty right now, we're doing our best to navigate how to balance the state budget this year and put more money into Medicaid at the state level, while also recognizing that in the next few months or a few weeks, we may see a very, very different reimbursement from the federal government. And that is what's causing a lot of people to lose sleep at night.
Just to underscore that point at the end there, you're talking about potentially losing $6 billion in matching funds and beyond from the federal government. You pointed out that there's $4 billion in the rainy day fund. So it's not as easy as just reaching out to beyond the fiscal guardrails to try to help you with Medicaid. That's just one part. Then you have obviously other funding priorities that people have, nonprofits or even something like funding higher ed. So this just kind of illustrates the task that you guys have ahead of you and how hard it may be to, I guess, do it all in one shot here in the session.
No, look, I want to be clear. I don't think that even President Trump or the Republicans in Congress are contemplating not giving us any of that $6 billion. But losing $1 billion, losing $500 million, all of that, to your point, Frankie, will be devastating and blow a huge hole in our budget at a time when we're trying to meet the needs of many people. We've gotten out of a fiscal crisis, and the one that we were in starting in 2017, in my mind, has largely ended. But we now have an affordability crisis in our state, and we're trying to meet that moment while continuing our fiscal progress. Losing money from Washington that we have counted on for decades in both Democrat and Republican administrations would have serious impacts to our ability to meet that moment.
A worst case scenario would be losing everything. You don't think that's going to happen, but a bad scenario would be losing $1 billion or something like that, or $500 million. And you think that you would have to make up for that maybe from the rainy day fund or just having to find some money elsewhere? You think that you'd have to reach into state coffers to make up whatever you lose?
Well, look, I don't make that decision.
Sure.
The governor and the legislature do, but they've both said on record, we're going to do everything we can to protect our most vulnerable people. But there are limits to what our ability is to do that based on the confines of our budget and the need to help all the people who are also being cut. But I think that we would do everything we can to step in, and we are planning for that moment actively.
As I mentioned earlier, we spoke with Republican State Representative Vincent Candelora ahead of this hour. He told us that any talk about proposed federal cuts to Medicaid from lawmakers would constitute what he says is a, quote, deflection of the issue. Let's hear his comment.
So this year's budget, we are over $300 million over budget in Medicaid. The growth in the projected budget for next 2 years is going to be over $250 million. Actually, it's over 300 million. So they don't want to talk about that issue. If by June we have a balanced constitutional budget, and we see down the road 8 months from now that there's a cut that comes into play that we cannot account for, certainly we would have to look at those emergency measures to fill that hole. But the state should do its own housekeeping right now and not wait for what's going to happen down the road.
Comptroller, could you respond to what you heard from the state representative there?
It can be both true that there is a shortfall in Medicaid that we have to plug, and we are going to plug in this budget, and that a federal cut to Washington, which would probably be 2, 3, 4, 5 times more than that shortfall, is devastating. Both of those things are true. But it is not a deflection to say that President Trump and Congress cutting a $6 billion program to us is the elephant in the room, and a several $100 million shortfall, while nothing to sneeze at in the context of a $20 billion annual budget, is not the biggest fear that we have. Do we have to plug that deficit? Absolutely. Is that health plan experiencing the same challenges that every plan in the world is experiencing of higher costs for hospitalization and drugs? You bet. But the higher cost of hospitalization and drugs will pale in comparison to the problem of us getting billions of dollars less funding from Washington to care for the most vulnerable amongst our society.
I wanted to dig in a little bit more with Rep. Candelora to see what he would do to try to solve some of the things he says that need to be done in the interim. He told us his position on the Medicaid budget is based on what he considers an overusage of an entitlement program. He points to a state law that allows children aged 15 and under, regardless of their immigration status, to be eligible for health coverage through the state-funded Husky programs. Let's hear more from him on that.
We're seeing the growth beyond what was budgeted because basically anybody outside of Connecticut can come here and receive those benefits. So I think we've got to look at the policy overall. We don't have unlimited resources, and so we need to prioritize them. If services are going to be provided, which they have to be, give a lower level of care that's going to cost the state of Connecticut less money.
Any response to that?
I'm not in favor as a father of giving a lower level of care to any child in the state, regardless of who they are or where they came from. These are kids we're talking about here. It's true that more people have signed up for that program than had been intended, but it's also true that those kids, as the representative says, if they get sick, as all kids do, trust me, I know that as a father of young kids, they go to the hospital because it's the only place for them to get care, and that hospital gets nothing back in return for that. Our hospitals are stretched to the max. If you go to an emergency room in any part of the state, it's filled with people. And part of the reason for that is because the hospitals are not getting reimbursed properly for the care that they're giving. At least in this iteration of it, we are giving them funds to care for those people. And when they don't get those funds, they just pass the costs along for that care to all of us, which is a reason why our insurance premiums are through the roof. So for me, it is a moral issue of covering all children in our state for health insurance. Do we need to find ways to save money in Medicaid? Yes. Are there efficiencies we can find? Yes. But we should not be talking about cutting that program at the same time we are expecting massive cuts to be coming from Washington. We need to figure out a sustainable game plan to care for the most vulnerable. And to my mind, that includes kids.
Any final thoughts for the listeners here, Comptroller Scanlon? It's good to have you on the show. I want to see if you have anything else for us here.
In this moment, everywhere I go in the state, people feel a little bit hopeless. They feel scared. They feel frustrated. And my message to them is use your voice. This is the time for you to call your representative, even if you think they agree with you, to put something on social media to talk about how this would impact you and your family and your community. When we speak up and speak out, you can still change things. And even if it feels like the odds are stacked against you right now, change is possible. And I believe we can stop these cuts, but we have to use our voice. And if we can't, we have to make a plan. We're going to do both, and I'm going to do both as the chief fiscal officer of our state.
You've been listening to State Comptroller Sean Scanlon. Comptroller, thank you so much for coming on the Wheelhouse.
Thanks, Frankie.
You also heard there from House Republican leader Vin Candelora. Thank you so much for him coming on the show as well and giving his thoughts on Medicaid. Coming up, a deeper look at Medicaid and how federal funding cuts may impact access to care in Connecticut. Are you someone who will be impacted by cuts to Medicaid? Give us a call, 888-720-9677, 888-720-9677. We'll talk to you after the break. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. State lawmakers anticipating more cuts to federal funding coming up. Medicaid is one line item that may take some big hits. Joining me now, Keith Phaneuf, state finances reporter for the Connecticut Mirror. Keith, great to have you on with us.
Good to be here.
Good to see you this morning. And also joining us in studio, Katie Kovala, health reporter for the Connecticut Mirror. Thank you so much for coming on, Katie.
Thanks, Frankie.
You got to hear both that conversation that I had with State Comptroller Scanlon and, of course, the talk I had with the House Republican leader, Vincent Candelora. Our phone lines are going to be open now, and we'd love to hear folks' thoughts about those conversations, Medicaid benefits, and the budget. Join the conversation, 888-720-9677, 888-720-9677. Keith, as I just mentioned, we heard from the comptroller, we heard from the Republican leader. Any reactions to what they had to say about federal and local cuts to Medicaid?
Just a little perspective, and I know Sean tried to clarify this. We're not going to lose $6 billion. I don't think anybody can promise what we're going to lose in a particular year. I don't think anybody is expecting the losses to be in a particular year in the billions, more likely in the hundreds of millions of dollars. The other thing is when Sean said provider rate increases are impossible, I don't know if his fellow Democrats in the legislature completely agree with that. You can't really discuss Medicaid without discussing the guardrails. I'll just point out quickly, we haven't updated our medical provider rates since 2007, which means if you're on Husky, and God forbid you need to see a specialist doctor, good luck finding one who's taking new patients, because we haven't increased what we pay them since, well, it took effect, those rates took effect in 2008. So since 2008. The other thing is we are better suited than any other state to deal with a Medicaid cut because we have been oversaving, believe it or not, for our pension debt. We've been running surpluses for the last 8 years of an average of $1.8 billion. $1.8 billion. We've been taking 8 to 9% of our budget out every year. One half of one generation has been trying to solve the pension debt problem created by 3.5. If people are going to be told provider rate increases are impossible, Connecticut cannot leach $1.8 billion every year out of healthcare, social services, education, town aid. Just by the way, so that our pension debt problem, instead of being resolved in the early 2050s, can now be resolved by the mid 2040s. That's it. In other words, we're not saying, well, we're solving this pension problem in a year or two, so put up with the pain. It's saying, can you hold your breath for 20 more years? And then we'll be done. The pace that we're paying off the pension debt has to slow down. That will be used to cover the Medicaid gap. If you can follow that. And I know I threw a lot at you
that's
fast.
Incredible perspective. Does that extend all the way into Medicare too? And essentially, I think you're saying that it's unsustainable that these hospitals and these providers are paying and not getting the reimbursement. Is that? I think that's what you're saying, that it's unsustainable at this point.
Well, Medicare is purely federal, so that's like
Sure.
literally between the hospitals and the federal government. But when it comes to Sean said our hospitals are being stretched. The reason they're being stretched is because we don't have enough doctors who are willing to take on more Medicaid patients. We have tons of people on Husky who are effectively uninsured because they can't find someone to treat them, or they can get into, if we didn't have the federally qualified health centers, and I'm sure Katie can tell you more, we would be completely stuck.
Katie, we're talking about Medicaid reimbursements here and the situation that people are feeling. And it sounds like there's people that are supposed to be getting Medicaid that aren't getting Medicaid.
There are people who are supposed to be getting care who aren't getting care. So they have Medicaid. They are technically covered, but when they get sick or need a specialist, for example, and they're going out there and they're looking for a physician who will accept their Medicaid insurance, they're not finding them. They might have to wait. I have private insurance. I had to wait 8 months for a primary care appointment. Those waits might be even longer for someone with Medicaid.
And is that because people are concerned that they're not going to get paid back once they see somebody that has Medicaid?
So Medicaid reimbursement rates, we keep saying this, but it probably just worth that is how much the state is paying the doctor to see a Medicaid patient. It is often much less than what private insurers pay. So, for example, a doctor sees someone with private insurance who has the flu. I'm making these numbers up, get paid $100, but they see someone who has Medicaid who has the flu, and they get paid $50. And a lot of providers are saying it actually costs more than $50 to even provide the care. So we're losing money. So many providers have to make what they say is a difficult decision to cut down or completely stop seeing Medicaid patients for that reason.
Ongoing topic of discussion in the state legislature. Can you help me break down exactly what Medicaid reimbursements are? I know reimbursement rates are. I know you were talking about it that way and the situation around it.
Yeah, so the Medicaid reimbursement rates are just how much the state, any state, in this case Connecticut, pays doctors for services they provide to patients with Medicaid. Keith and the comptroller spoke to this, but for years now, providers and legislators have been saying these rates need to come up. They haven't been raised since 2008. It's causing access issue for patients. And right now, there are a couple proposals in the legislature. One is from the governor himself. So in his budget proposal, he is saying let's put $35 million over the next 2 years towards increasing rates for certain providers that we know we underpay. Many providers and his Democratic leadership say that's not nearly enough. So Democratic leadership also has a proposal that would put $200 to $250 million, I believe are the numbers they've put towards it, over the next 3 years to increase those rates. So that's obviously a much bigger spend.
888-720-9677, 888-720-9677, the number to call if you have any questions related to Medicaid. Connecticut's community health centers, also called these federal qualified health centers, the FQHCs, are taking steps toward legal action against the state over low reimbursement rates. So far, filing a petition, as I understand it.
Yeah, that's right. So they basically filed what's called a declaratory ruling request. And they sent it to the state, and they said, hey, these are the federal and state laws around how often you're supposed to review our rates and when you're supposed to raise them. Do you think you're complying with those laws? And so now the state gets 90 days to respond.
So I'm wondering if it's we talked about the equation, Keith, with the comptroller earlier, where he's saying that we're putting in $3.3 billion, something like that, and there was more than a match this year from the federal government. In his numbers, he said there was $6 billion. Are we saying that the state may have to put even more into Medicaid to help make sure that some of these folks that are providing care are reimbursed?
Well, the state may end up putting in more. And just to give people an idea, yet Sean's correct, we're actually, the $3.3 billion is just what's in the Department of Social Services line item. Connecticut's spending on Medicaid's about $4.4 billion.
Oh, wow.
And we get about 6.1 from Washington. So you get about 10.5 billion total. So if the amount from Washington goes down, ours can go up, and it still doesn't mean overall. We might be lucky if we're just treading water. Just 2 points though, Frankie, to build on what Katie said. There's this myth in Connecticut. I really think there is, that because we're one of the wealthiest states in the nation, every service that we have is the Cadillac of services. So even if it's cut back, how bad can it be? A couple years ago, Kaiser Family Foundation, now they're KFF, they ranked where states are in terms of the Medicaid rates they provide. The Medicaid rates that we pay specialists ranked 42nd out of 50 states. We're not competing with New York and Maryland. We're competing with West Virginia and Mississippi.
Wow.
Even though Connecticut is, along with New York, one of the two greatest states in the nation for income and wealth and equality, meaning there are some folks in Connecticut who have no idea what we're talking about. And there are other folks who are, like I said, I have basically the same access to specialist doctors that somebody in one of the poorest states in the nation would have. Connecticut, or any state, when you ignore a problem for 20 years, you're going to find you're grossly out of whack. And then the other point I just wanted to add is, Sean had mentioned how our nursing homes, the majority of our residents in nursing homes are on Medicaid. And he's technically correct when he says, we're talking with Medicaid about some of our poorest people, but a lot of the folks in nursing homes were people from middle income households who had to spend down their assets to qualify for Medicaid. In other words, they could have gone into a private pay home for a year or two, but that would have exhausted what they had. When you say what families have relatives in nursing homes, they come from basically all but the wealthiest families, and we have not been providing inflationary increases to our nursing homes for years. So we've already seen what happens with Medicaid rates when you don't keep up. Nursing homes aren't quite there, but they're catching up fast.
Katie, you mentioned earlier that Connecticut's community health centers have filed that petition, or the declaratory schmozzle.
Request. Yep.
Yeah. With the state over Medicaid rates. Where does that petition go from here? What's the timeline on that?
Right. So the state now has 90 days to respond. They haven't. The most they've said is just they acknowledge that they've received it, and they're going to respond to it in compliance with the law. But basically, if the community health centers don't agree with their responses to those questions, they can then go ahead and file a lawsuit in Superior Court.
Keith, is the governor planning to address this issue of rate reimbursement in the 2025 legislative session, or the lawmakers even? Or has he even acknowledged this issue?
The legislature tasked the Lamont administration a couple of years ago with doing a study on Medicaid rates, and the Department of Social Services has been doing that work. The governor didn't propose any changes. Just to give you an idea of also where their cards are, last spring, 12 months ago, basically, when they were negotiating the budget for the fiscal year that we're in now, they had approached the FQA, the federally qualified health centers, about basically signing away their rights to go to arbitration over Medicaid rates. The FQHCs didn't bite on that. But I don't think there's a lot of expectations that the Lamont administration is going to be pushing to bolster Medicaid rates, given what's going on right now. Like I said, it's going to come down to a fight over, can we continue to save so incredibly aggressively when we've been leaching arguably needed resources away from other problems, and then they're about to lose a ton from Washington?
I think we're digging into the nuance here as you do better than probably anybody into the state, Keith, so I appreciate this. Let's go even further into it and help me understand. I may be out of left field here, so tell me if I'm out of pocket. But I know that the administration has been talking so much about having to fill in potentially wherever the federal government steps away on Medicaid. But is this? I'm listening to what you just also told me. So, are they maybe paying a bit of lip service to that? Are they actually going to try to do the best that they can to get more money into Medicaid, or am I missing part of this issue here?
No, I think you're going to see that. First of all, I do think if Washington, and I expect they will, cut Medicaid, the question is simply how much. Do I think the administration will look to patch that? Sure. And do I think the governor will go as far as say the majority of the Democratic legislators who control the House and Senate here in Connecticut will want to go? No, I don't think he'll go as far as they want to go. The reason I keep going back to these guardrails, if I had to ask your listeners to come up with an analogy for their household, let's say everybody started bolstering their savings, but you did it by dramatically cutting your grocery budget. You didn't pay on your car bill, your mortgage. All of a sudden that savings, and your listeners have to imagine we're using sarcastic air quotes around savings, yeah, you're going to realize that savings was not really achieved in a healthy fashion. And now if all of a sudden you got a pay cut from work as well, that's how I'm trying to describe the Medicaid situation in this labored analogy. You have no choice but to realign how you save money. That's what's happening here in Connecticut. I mean, there have been arguments that, I mean, in theory, we're only supposed to be saving volatile money, outlier money, meaning revenues that surge one year that are not likely to do it year after year after year. Well, the problem is we keep coming up with about $1.8 billion in surpluses, like we're stamping out license plates. You can't have reliable money. It's one or the other. And our quote unquote volatile money comes in an incredibly stable fashion.
He's talking about volatile money here. COVID relief dollars obviously playing a role here. COVID relief basically stood the state up during the pandemic for a long time, and now that money's gone away. We've seen it impact a lot of different places. Katie, what are you seeing that as far as the impact here on Medicaid?
You know, there are some programs that the state has passed that was, and this doesn't just relate to Medicaid, but of course in general, there were some programs that the state passed that relied exclusively on ARPA funding. So of course, you know, that's a game changer now. Those funds are not available. Keith might be able to speak a little more towards whether there are places in Medicaid that rely specifically on ARPA funding.
Go ahead, Keith.
Oh, Katie's right. We used money from the American Rescue Plan Act to patch up some of these services that we deliver to people with disabilities, behavioral health programs for children. That we provide most of those services through contracts with community-based private nonprofit groups. They're usually running on shoestring budgets to begin with. I always ask people to think of this ARPA as sort of the best fiscal Novocaine. While these guardrails were extracting about 9% of our budget every year, people would say to me, well, it couldn't have been that bad. I didn't notice everything going to hell in a handbasket. Well, that's because at the same time we were doing that, I won't say we had the good fortune to have a pandemic because that was tragic, but Connecticut received $2.8 billion that basically we could spend between 2021 and this year. So every year that we extract a big surplus, we put some of it back with this ARPA money, which was very flexible. Emergency federal money can be spent outside the spending cap. There's no limits. But all that ARPA is gone now. So the Novocaine's over. And now you're going to really feel that this extraction of money by the guardrails. At the same time, Washington is about to take a big chunk. Something has to give. And it can't just be cutting programs that have largely been neglected for the better part of 20 years.
Have a caller right now from North Haven. Go ahead, Jared.
Hello, thanks for taking the call, and I appreciate the topic today.
Thanks for coming on the show. Appreciate it.
Yeah, I have a mother. I've been caring for her with dementia. We did what is very common. We put her in a private pay and did the drain down. Now she's been in a facility for the past 2 or 3 years on Medicaid. and just curious to know what might we expect as a family and also the facility with these things on the horizon for Medicaid in the next year or two.
Jared, thank you so much. Please continue to listen as we'll go into that. Keith, that's exactly kind of what you spelled out, what Jared's going through now. What should he expect going forward?
Katie, my wife, Jenna Carlesso, my colleague Dave Altamari have done a lot of reporting on the quality of care in nursing homes. I would urge people to look at the Connecticut Mayor's Elder Care series.
Absolutely.
The industry is absolutely struggling, and a lot of people are finding that care is slipping in a lot of our homes that rely on Medicaid funds.
That is important to highlight that series. Dave Altamari, of course, Jenna does an outstanding job on reporting on this, and Katie as well. Go to ctmirror.org for more on that. Katie, can you speak a little bit more to the situation that Jared's finding himself in and his family is as well?
Yeah, I mean, I think what Jared is calling in with is just really highlighting what the comptroller said earlier, which is that these are not just abstract cuts. They are going to impact everyone. So we don't know exactly what shape these cuts will take or what exactly their impact will be, but it's very likely that some providers will have to cut services. We've already seen a community health center that stopped offering dental services because the Medicaid reimbursement rates are too low. And so imagine that if providers are getting less money from the federal government or from the state through the federal government, they are just going to have to make some cuts to services. So I expect that access and quality will decline. But of course, that will be dependent facility to facility.
I don't want to keep harping on this, but it's a tremendous example. So I thank Jared for calling. But help me understand, guys, where Jared should be looking here, or at least you guys are journalists, so I don't want you to tell Jared or to do the work for Jared here or to advocate. But is he looking at the federal cuts? Is he looking at reimbursement rates? Where should he be looking to get more information on what's happening?
I think
what direction, I guess.
Yeah, I think that probably the impact from the Medicaid reimbursement rates is already being felt. I would say that what we are looking towards are those federal cuts. And I would be happy to do that work for Jared if I felt like there was the opportunity to. But I think right now, what legislators and providers and everyone is saying is just we don't quite know how this is going to play out just yet. But as Keith said, the cuts are likely. It's really a matter of how large they will be.
Yeah, the smart alecky answer to your question, Frankie, is just, should it be looking at this or that or this? And the answer is yes to all the above. The problem is Connecticut's sort of holding its breath right now, along with the rest of the nation. We typically adopt our budget at the end of the legislative session, so we'd be talking about early June. Even if they adopt a budget, which they may well, it's almost going to be like consider this a first draft type thing, and we'll be back in special session in late summer or even early fall or early winter, depending on how effective Congress is in giving us clear direction. So I think nobody really knows, how can I say this politely for WNPR, when the fit is going to hit the shan. But I think that that everyone is not sure right now. So we are stuck in sort of a holding pattern. I hope that passed muster.
It did. I had my arms up. A touchdown. It was a touchdown. I appreciate it. We got to dig more into this and whether or not the fit is going to hit the shan. Right after this, you are listening to The Wheelhouse on Connecticut Public. Let's take a quick break. This is The Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. Medicaid, one of the nation's largest health insurer, is the nation's largest health insurer. I can't speak today. Covering approximately 80 million Americans. That's according to the Centers for Medicare and Medicaid Services. Right now, Republican lawmakers in Congress are eyeing government spending cuts. This could threaten coverage for Medicaid recipients. So how might that impact Connecticut residents? Well, we're going to find that out, as I made a joke in the break, of the ARPA dollars of Connecticut Public is the CT Mirror. They always stand us up here on the Wheelhouse. Still with me, Katie Golvala and Keith Faniff. Keith, with a dazzling metaphor, is on Zoom. And, of course, Katie Golvala is right here in studio. You could join us on the phone, 888-720-9677, 888-720-9677. Congresswoman Rosa DeLauro, Katie, worries that the federal government will soon jeopardize health care for older adults, children, and low-income families. She joined a group of lawmakers advocating against Medicaid cuts last week outside of the state capitol.
These are our neighbors, our friends, families that we know. They are now in danger. My friends, Medicaid is in mortal danger.
Mortal danger. Very strong words there. Have we heard it explicitly stated by the Trump administration that they're eyeing cuts to Medicaid? And if not, then why are politicians, why are people like Sean Scanlon saying that it's going to take a hit?
So, no, they have not explicitly said that they are cutting Medicaid. In fact, the Trump administration has said they will not touch Medicaid. But we need to go back to what the comptroller walked us through as to the cuts that they're trying to make. So, the House Republican budget bill calls for $880 billion in savings from the House Commerce and Energy Committee. That committee oversees certain plans. The biggest by far are Medicare and Medicaid. Touching Medicare is like a political third rail. Like you just don't do it. And many people believe that even the Trump administration would not touch that. So now the only option to hit that level of savings that they are looking for, the only program big enough that can help them get there is Medicaid. And so that is why, despite Republicans and the Trump administration saying they're not going to touch Medicaid, that's not explicitly stated in the bill, that is why we're seeing so many state legislators ring the alarm.
Can you help me understand very briefly why that's a third rail touching Medicare? Does it have to do with the fact that most of the people on Medicare might be of a certain age or race?
And
maybe
they definitely go out and they vote.
Okay.
And it just has come to be one of, the most popular federal programs that we had. I don't know if Keith has anything to add to that, but
No, I think that's
you don't touch it
right
Keith.
there.
Is that what you're saying?
don't touch it.
I'm looking for another metaphor. I want to change my title to foul mouth hooligan, but
let's text Jenna. Let's see what she has. If she has
exactly. I think it just comes down to when you mess with retirement benefits, you're asking for trouble at the polls. So yeah, and to Katie's earlier point, she's right. It's simply the math. You don't have to name Medicaid. If I just say that I hate every number between 10 and 1, I'm talking about 2 through 9. It's just another way of saying the same thing. But I think Medicaid is the only way to even approach the types of targets the Trump administration is talking about.
We have another caller. It's Dr. Daniel Sunderland from West Hartford. Go ahead.
Hi, yes, thank you so much for talking about this important topic. I'm a primary care doctor. I work out of West Hartford, and I do take Medicaid at my office. And I just want to let people know, one, just reiterating what one of your guests said before, we all do bear the cost of Medicaid effectively. And the reason why is that if your hospital stay, you're getting billed there, that hospital is going to need to cover all the people on Medicaid as well, or people who who aren't able to pay anything at all, who maybe don't have Medicaid. So when that gets shifted over to your private insurance premiums. This is not just a people who have Medicaid problem. This makes it healthcare more expensive for all of us when those people on Medicaid don't have primary care. They're not able to come in. They're not able to find someone who takes Medicaid, which, a lot of times I feel like I'm in the minority taking Medicaid, but a lot of some of my colleagues also take Medicaid, but when I try to refer to specialists sometimes, or, people calling around just to find a primary care, a lot of times the answer they get is, I'm sorry, like our business model has, shown that we're not able to provide that care.
Daniel, I appreciate the context. I would have kept talking to you about this, but I only got 4 minutes left on the show. I appreciate it. Thank you so much, Daniel, for calling in. Please be sure to call into another Wheelhouse shortly. You heard that perspective of what it's like to be a provider, Katie, and then decide whether or not we're going to take Medicare or Medicaid. Sorry. What did you think about that perspective?
This is exactly what we've been hearing, what legislators have been hearing from providers all across the state. Ultimately, this becomes an access issue for people on Medicaid, and it is also, the system is bearing the brunt for these costs in other ways.
And then you had Andrea Barton-Reeves, Governor Ned Lamont's Social Services Commissioner, talking about work requirements. I think some people like when you say work requirements, mainly maybe Republican lawmakers or something like that might generally like that. Am I referring to this in the wrong context, or what do you think about potentially what we heard there as being a realistic first step? And then what would happen to those folks who aren't working or can't work?
That's a good question. So what the commissioner said is true, that there seems to be a misconception that people on Medicaid don't work. And I think there was a 2023 study done and found that 90% of working age people who were not getting disability payments were working. So most of the people who can work are working. And many other people are in school, they're caregivers. So this idea, this misconception that she was trying to talk through, it just, the numbers don't bear it out. And then you were asking about what shape these work requirements could possibly take. And again, I don't think we know, but under the previous Trump administration, a few states tried to put work requirements into place. Many of them had a requirement for how many hours in a month you had to be working. And many, but not all, contained exemptions for people who could not work. So I think, if I had to guess, it would be some kind of hour-based requirement, and that there would be exemptions for people who could not work.
Keith, less than 45 seconds to answer this following question. Cuts to Medicaid impact people across both political parties. I expect that you would imagine that to be the case. But might the president keep his promise to, quote, love and cherish Medicaid, as Politico reported back in February? Or is that lip service? What do you think?
Well, you can't have it both ways. If he does want to cut the federal budget significantly, and we're probably, we're not talking about eliminating the deficit, just cutting the budget. There's just no other way to get around it other than Medicaid. I would be very surprised if Medicaid escapes unscathed.
That's Keith Phaneuf of the Connecticut Mirror. You could see more of his work and Katie Govala's work, the health reporter at the Connecticut Mirror, at ctmirror.org. Katie, Keith, thank you so much for coming on the show.
Thank you, Frankie.
Thank you.
Today's show produced by Chloe Wynn. It was an excellent program, edited by Robin Doyen-Aiken and Meg Dalton. Our technical producer is Dylan Reyes. Thank you so much to our visuals and operations department here at Connecticut Public, and of course, Megan Fitzgerald and our talk show unit. Download the Wheelhouse anytime on your favorite podcast app. I'm Frankie Graziano. This is the Wheelhouse. Thank you for listening.